Well, when I was the education secretary back in the end of the first decade of the 2000s, we did face some outbreaks of bird flu. We did have lots of meetings to consider how we would handle a pandemic, how we would keep the schools open or close them, the impact that would have on families and on the health service. I don't think back in all that scenario planning, any of us ever thought about schools being closed, not just for a few days or a couple of weeks, but month after month after month. This has been beyond anything that I ever expected, that we planned for. I think that's why it's so hard for the government to handle. But I remember from back then, days lost from schooling are days you don't get back. I think it's very hard for the government making all these different balances. And the most important thing is to ease the pressure on the health service by making sure that the most vulnerable, older people, people with complex health needs are vaccinated so that they don't end up in hospital, as so many have done in the last year. But I do feel that if at all possible, frontline public service workers like teachers and the police, who need to be at work, as nurses and doctors do as well, in order to make sure that our streets are safe and our children can learn, they need to be right up toward the front of the queue. And I hope that that teachers will be given the support and the confidence to get our schools open.